So hello friends, I hope I am audible and visible to all of you. Please give me a quick thumbs up if my audio video is fine. All my dear students, please give me a thumbs up. Let me know if my audio video is fine. Yes. So today we will be doing another very important topic, and that is leprosy, which is very frequently asked. They do give a lot of questions with respect to leprosy. Specifically, they give you the questions with respect to the diagnosis. In this NEET PG also we have a lot of questions with respect to leprosy. So welcome Abhishek and all my dear students. Please do attend these classes. They are very important for the upcoming exam, that is next or INI-CT or the December FMG. So let's begin with the today's session. I am Dr. Chesta Agarwal, your NEET PG educator on Unacademy. You are on the best online platform for the preparation of the pre-PG entrance examination, that is Unacademy Learning App. Now please download the Unacademy Learning App from the App Store. Please download the Unacademy Learning App from the App Store and choose your category, that is NEET PG. Once you choose your category NEET PG, you have two options. One is the special live classes and the second is the paid subscriptions, which are of two types, Plus and Iconic. Special classes are very similar to the paid classes in the respect of the interactive live classes. You have option of polls, you have raise a hand feature, you will never miss a class because you will get the notifications. You have lecture notes and you can access them anytime, anywhere from any of your device. Now we have two type of paid subscriptions. One is Plus, which give you an access to live classes on Unacademy from the top educators and around 25,000 plus question bank. You have, in addition to Unacademy, in Iconic you will get prep ladder. Along with that you will have the personal guidance, the test analysis, the strategy planner. Everything is included in your Iconic subscription. Now we have 25,000 plus questions which are based on the latest exam patterns. It includes detailed explanations. We are proud of our learners who have done very well in their exams. The recent exam, that is FMG June 2021. We are still awaiting the results of NEET PG 2021 and we are sure that majority of our students have done amazingly well in their exams. Now the batches which are starting today are the next pattern starting on 15th and the FMG batch starting again on 15th. Both the batches are very important and I will be taking dermatology in them. The classes are starting today from 3 p.m. to 5 p.m. Starting from today, that is 3 p.m. to 5 p.m. I request all my dear students to please be live for these classes. Now there is another batch which is the clinical examination and the procedural batch, which is very important for the 4th professional year MBBS students. Here you have clinical examinations and case discussions in an educator learner format. You have clinical skills, procedures, well structured and planned courses. I request that please be a part of it. This is a very important, amazing platform for your exam. Now another very important point is we are giving you the longer subscription offers, that if you buy a 2-year or if you buy a 2-year subscription of Unacademy, you can get 4 months for free, and if you buy a 12-month or a 1-year subscription, you will get 2 months for free. I request all my dear students to please be a part of it. 2 years will give you a 4 month and 12 month will give you a subscription of 2 months. Now this is the cost of the NEET PG subscription. We have 1 month, 3 month, 6 month and the longer subscriptions in Plus. While in Iconic the subscription starts from 12 month onward. Using the referral code CHESTA10, CHESTA10 will give you amazing additional discount. Using the referral code CHESTA10 will give you amazing additional discount. Now lastly, we have a bug bounty program that if you find any inappropriate content, you can report and claim your prize. Starting with the first question, today we have leprosy, which is a very important topic. assertion that slit skin smear is negative in TT leprosy, and the reason is TT is a paucibacillary leprosy. Now what is the reason? Both assertion and reason are true. Reason, assertion are true but not the correct explanation. Anybody can tell me the answer for this question? Chalo. So I will tell you in brief about leprosy, what exactly is leprosy and how the infection progresses. Now, leprosy is an infective condition which occurs secondary to Mycobacterium leprae. Mycobacterium leprae is very similar to that of Mycobacterium tuberculosis, but there are few differences. First of all, Mycobacterium leprae, it grows at 30 degrees centigrade, almost 7 degrees cooler than the core body temperature. Okay? That is the one very important point. Second is, you cannot culture it on the artificial culture media. You cannot culture it on artificial culture media. You cannot culture it on artificial culture media. That is the another point. Coming to the next, you have involvement of skin as well as nerve. You have involvement of skin as well as nerve. Why? Because 30 degree, which is the cooler body environment, occurs in the skin, which is the superficial mode part, as well as the peripheral nerve, which is present more superficial. So what happens once the leprosy bacteria or Mycobacterium leprae gains the entry to the nose, it proliferates in the nasal mucosa, and then it enters the nerves and it circulates to the other body part. It can also enter the blood and can have hematogenous spread to the other part of the body. Okay? So please give me a thumbs up if you understood till here. Now what happens depending upon the immune status of the individual. For example, if a patient is having poor immunity against Mycobacterium leprae, you will see widespread involvement of the skin. But if a patient have good immune system against the Mycobacterium leprae, the lesion will be localized to a one particular site. Clear all of you? The lesion will be localized to one particular site, and that is how you can differentiate both of them, that whether it is the TT pole where you have localized lesion or lepromatous pole where you have generalized lesion. Towards TT pole, the CMI is very strong, and that is why the acid fast bacilli are very less. While in lepromatous pole, because CMI is poor, the acid fast bacilli is strongly present. And that is what is asked in the question, that what happens when you do a slit skin smear examination. You will see the negative result. The reason, because TT bacilli having a strong cell mediated immunity, the number of bacilli will be very less, and for slit skin smear to be positive, you should have at least 10 to the power 4 bacilli. Until unless 10 to the power 4 bacilli per gram, you will have negative slit skin smear test. Clear? Abhishek, Shreya, please give me a thumbs up if you understood. Very important with respect to leprosy. Please give me a quick thumbs up. Slit skin smear is negative in TT leprosy, and TT is a paucibacillary type of leprosy. A paucibacillary type of leprosy. Coming to another point, so this is a step of doing a slit skin smear. With the help of the index finger or the thumb, you will pinch the site to make it avascular. You will give a deep nick, 3 to 4 mm nick. You will scrape the margins of the lesion, and then you will spread it onto the glass slide. And after staining it with Zn stain, that is, you will apply carbolfuscin, you will heat it, then you will give 5% H2SO4, and then you will put methylene blue. This is how the appearance look like. You have pink color lesions all over. You have pink color lesions all over, and the background is of blue color. Background is of blue color. So that is a pink and blue appearance of the lesion. Pink and blue appearance of the lesion. Okay? So please give me a quick thumbs up, all of you, if you understood this point. Shreya, Abhishek, anyone has any confusion? Okay? So these pink structures are the acid fast bacilli, long cylinder. Okay? While the background is blue because of methylene blue. Now we have another question. भर के ले आना, पानी भर के ले। Anyone can tell me the answer? Check the MDT schedule in adult leprosy and mark the correct option. Rifampicin 600 mg once a month supervised. Clofazamine 300 mg once a month supervised. Depson, anyone can answer. So please remember, the WHO have classified leprosy patients into two broad groups, paucibacillary and multibacillary. Paucibacillaries are those where you have 1 to 5 skin lesions, smear negative. You have 1 to 5 skin lesions, smear negative, and you have presence of either one nerve or no nerve. While multibacillary is more than 5 skin lesions, smear positive, and nerves are more than equals to 2. In paucibacillary, you give 3 drugs: rifampicin, clofazamine, and depson. And in multibacillary also you give 3 drugs: rifampicin, clofazamine, and depson. Rifampicin, clofazamine, and depson. And how to differentiate? In paucibacillary you give these drugs for 6 months, while for multibacillary you give these drugs for 12 months. You give these drugs for 12 months. Clear, all of you? Please give me a quick thumbs up if that is clear. So multibacillary and paucibacillary, what is the difference? 3 drugs, both of them. The only difference is in the duration. Now what is the dosage? Please remember, rifampicin is given 600 mg once in a month. Clofazamine 300 mg again once in a month. Depson 100 mg daily, and clofazamine 50 mg daily. Please remember the sequence. Okay? Clofazamine and depson has to be given daily, and 300 mg of clofazamine and rifampicin has to be given monthly supervised. So the correct answer here is all of them except option number C, because 100 mg is given. So the answer becomes number 1, that is A, B and D are correct. Okay? Abhay, Shreya, is this question correct? Anyone has any confusion, please let me know. Anybody has any confusions, please let me know. Check the MDT schedule in adult leprosy and mark the correct option. Mark the correct option. Coming to the next question. Leproin test is positive in tuberculoid leprosy, and the reason is leproin detects the T cell immune status in children. Anybody can answer this question. The leproin test is positive in tuberculoid leprosy, and leproin detects the T cell immune status in leprosy. Both assertion reasons are true, and the reason is the correct explanation. Anyone can answer this? Fine. Very nice. Very nice. Now what is leproin test? Leproin test is a type 4 hypersensitivity reaction. It is an intradermal test which is done in a patient of leprosy, which is used for monitoring the therapy or for epidemiological purpose. It has no role in diagnosing. Why? Because it is a type 4 hypersensitivity reaction, and it becomes positive only when you have cell mediated immunity positive. And we have just now discussed that in lepromatous leprosy, CMI is negative, so leproin test will become negative. Okay? While in TT leprosy, because of T cell mediated immune response, you have presence of the or positive leproin test. We have 2 types. One is Fernandez, which is the early. How to remember? F of Fernandez and F of fast. So within 48 hours, if you see a papule presence of induration, then it is Fernandez. And if after 4 weeks it becomes visible, it is known as Mistuda, which is a little late reaction. Now please remember, Abhay, the correct answer is option number 1. Lepromin test is positive because it detects the cell mediated immune status of the individual. So both of them is correct. ठीक है श्रेया and Abhay? चलो जी. Another question. A 45-year-old male had multiple hypoaesthetic, mildly erythematous large plaque with elevated margins on trunk and extremities. His ulnar and lateral popliteal nerve are on the right sides. What is the most probable diagnosis? Lepromatous leprosy, borderline leprosy, borderline tuberculoid leprosy, or borderline lepromatous leprosy? Anyone? Again, very nice. Sparrow, Shreya, everybody is right here. Now here, whenever you get these type of questions, I will tell you a very simple mnemonic to solve them. A very simple mnemonic to solve them. Okay. Now first of all, whenever you get a clinical question from leprosy, always look for the involvement of the lesions. Where you have few lesions, whether they are few or whether they are multiple. Whether they are few or they are multiple, very important. Okay, few or multiple. Okay. Now few lesions, few skin lesions, TT, BT. Multiple lesions are further divided into asymmetrical and symmetrical. Asymmetrical is mainly borderline. Symmetrical can be of two types, lepromatous leprosy or borderline leprosy. Please give me a thumbs up if you understood. I think it is a very simple or an easy chart which differentiate the skin lesions from few lesions to multiple. Okay? So few means 1 or 2 less than 5 lesions which are present. Please give me a thumbs up if you understood till here. Now, the confusion comes when you have to differentiate between BL and LL. Because obviously if they give asymmetrical, you will think of BB. If they give few, you will get confused between TT and BT. And in the question, they have clearly mentioned that it is multiple. Okay, so this has to be somewhere here. This has to be somewhere here. This has to be somewhere here. Now please remember, look for the nerve involvement. If you have involvement of nerve present, that is hypoesthesia, involvement of the skin over it, dryness of skin, pain, sensation loss. If nerve is involved, then it is BL, while the nerve involvement is not seen in lepromatous leprosy. Clear? So this is a very important point. And why nerve damage is not seen in lepromatous leprosy? Because the nerve damage which occurs in a leprosy patient is mainly because of cell mediated immune system. It is mainly because of cell mediated immune system, and if the CMI is deficient, the nerve will not get affected. Although you have a lot of acid-fast bacilli inside it, but it will not get affected. Okay? Clear or not? Please give me a quick thumbs up if this point is clear. I think it's a very easy question. Amazing all of you. Chalo. So here the answer becomes borderline lepromatous leprosy. Moving to the next question. So this is a animal model on which you grow the lepra bacilli. Fine. A 6-year-old child from Tamil Nadu presents with solitary anesthetic patches. What is the possible diagnosis? Pityriasis alba, indeterminate leprosy, pityriasis versicolor, or tinea infection? Anyone can tell me the answer? Anyone can tell me the answer? Six-year-old child from Tamil Nadu presents with solitary anesthetic patches on the face. What is the possible diagnosis? Amazing, all of you. Please remember the correct answer of this question is pityriasis. No, indeterminate leprosy. Now, whenever you see ill-defined lesions on the face, it could be two, either ELBA or indeterminate leprosy. How to differentiate? First of all, look for a positive family member. If there is a positive family member, always suspect indeterminate leprosy first. If there is no positive member in the family, then what you do, you will look for the other features, that is loss of sensation, presence of scale, presence of itching. If there is loss of sensation, it is a clear-cut case of indeterminate leprosy. But if you have the presence of scales and all, then it is a case of pityriasis alba. Okay? So the correct answer here becomes option number 2, because they have clearly given that it is anesthesia. Now this was a direct question which I think I asked so many times in my classes. A direct repeat question which I usually ask, and you all got in your exam also. Please tell me the answer. Anyone can tell me the answer for this question? Very nice, amazing everyone, amazing everyone. Please remember this point, that whenever a patient presents to you with lepra reaction, whether it is mild, it is moderate or severe, always keep on continuing the MDT. You will never stop giving the patient multi-drug therapy, because it is very, very important. If you stop giving multi-drug therapy to these patients, what happens? The reaction can get more worse. The patient can succumb, because there is sudden increase in the inflammation. If you stop giving the drug, the bacilli will also increase. So never stop giving a drug. And whether it is type 1 or type 2, you have to always add oral steroids in these individuals. You have to always add oral steroids in these individuals. Okay? So the correct answer is option number 1, that is stop anti-leprosy drug. Stop anti-leprosy drug. Okay? Now there are two types of lepra reactions, type 1 and 2. In the exam this year, you got a question from type 1 lepra reaction. Whenever they write that the lesions, the existing lesions becomes more red, swollen, inflamed, along with the involvement of nerves with minimal systemic involvement, it's classically type 1. While in type 2, you tend to see new lesions with involvement of the other organs, more frequent, no nerves involvement, that is type 2 lepra reaction. So this was a direct question which you all got this year for your upcoming exams. ठीक है जी, चलो clear है? All of you give me a quick thumbs up. Everyone, so you will never stop giving. So this is the type 1. This is a type 1 lepra reaction. You can see the red inflamed. You can see the red inflamed plaque, while this is type 2 lepra reaction. This is type 2 lepra reaction. Okay, ji? Inverted saucer shape lesions are found in. Very nice, all of you, very well done. Please remember the inverted saucer shaped lesions. The inverted saucer shaped lesions are found in, the correct answer is borderline. So clinical features, let me see if I have an image of the clinical of all of them or not. Let me see. No, I don't have the images, but I'll show you what happens like when you progress or when you move from the BB or the TT pole to the LL pole. What happens? In TT pole, you have few lesions which are very well defined. When you look it from the side, you have perpendicular margins like this and you have sloping centers like this. Okay, bilkul exactly like this, exactly similar to a stadium. Have you seen a stadium ever? Have you seen a stadium? Yes. So this is how a TT leprosy look like. In BT leprosy, you tend to develop few satellite lesions surrounding the main lesion. While in BB lesions, what you see, you have exactly opposite of this. You have sloping margins and punched out center, and this will give you an appearance similar to inverted saucer shape, and the correct answer here becomes option number 3. Okay, so NEET PG, Abhay, Robin, please remember the inverted saucer shape or punched out appearance. Inverted saucer shaped or punched out appearance is seen in a patient of borderline leprosy. Borderline leprosy. Anyone can tell me the answer of this one? Single erythematous anesthetic patch with satellite lesions on the forearm. What is the likely diagnosis? Amazing, all of you, amazing. You can see that there is satellite lesions, and satellite lesion is a feature of borderline tuberculoid, and that is why the answer here becomes option number 2. Any confusion? NEET PG, Abhay, Robin, please give me a quick thumbs up if you understood this question. Anybody with any confusion, please let me know. This is very important from your end. So thank you all of you. We had discussed a lot of questions with respect to leprosy. I want all my dear students to please be live on Unacademy classes. We have a lot of offers going on. Please do subscribe to Unacademy. Use the referral code Chesta10 to get these reduced prices. Very important. Those who are targeting FMGE, targeting INI-CT, and those who are targeting NEET PG or next NEET PG or next 2022, I request them to please subscribe to Unacademy using the referral code Chesta10. They can even go for shorter subscriptions like 1 month, 3 months, 6 months for Plus or for Iconic. Okay, so they can go for any of these type of subscriptions using the referral code Chesta10. Using the referral code Chesta10. Clear है all of you? ठीक है? So these are the price list. Please go ahead and subscribe to Unacademy using any of them.